Hi, this is Keith. This is the lecture for Chapter 7. If you haven't read that chapter yet, it's a good idea to do that first and then watch this presentation. In this presentation, we'll discuss sexuality in early, middle, and late adulthood. Let's get started. Early adulthood is an exciting time. There are several developmentally appropriate concerns that challenge young adults as they continue to understand and shape their sexuality. These can include establishing sexual orientation. So while exploring sexuality is normal during childhood and adolescence, it's really in early adulthood where sexual attraction as an identity begins to emerge. We also find ways to integrate love and sex. In many ways, our culture teaches us to see sexuality through a sex lens or a love lens. It's as young adults where we start to really experience that sexuality can be both. This is also a time that individuals forge intimate relationships that involve serious commitments. Sex and sexuality can be a way of strengthening these commitments, but keep in mind that the age at which these major commitments, like marriage, are made can vary across time and cultures. For others, young adulthood is a time when they might start thinking of issues of fertility and childbearing. Now, this is definitely not an equal priority for everyone, but in people's 20s is when many begin to think about the timing of childbearing. Because sexual activity picks up for persons in their 20s, this is a time of heightened awareness of sexually transmitted infections, or STIs, and the ways that we can guard against them. Now, we'll discuss STIs and HIV later in the course. Finally, there's a shift away from making sexual decisions based on what authorities, like our parents, tell us is right or wrong, and more based on our own principles and moral code. In other words, this is a time when people ask themselves, what do I believe is the right path for me with regard to my sexuality? One aspect of sexuality that has received more attention recently is sexual orientation and gender identity. Research tells us that most people develop a heterosexual identity by adolescence or young adulthood. Now, this task is a bit more straightforward for heterosexual and cisgender persons, since heterosexuality has historically been normative in our society, and there are sort of fewer obstacles to that identity development. For those who are attracted to the same or both sexes, identify as queer or are unsure, sexual identity development can elicit some doubt and anxiety. It can take persons who are LGBTQ plus longer to understand their sexuality since many of the messages that they've received about their sexuality from society can really conflict with their own internal experiences. And it also might be difficult or sometimes even dangerous to establish a relationship for members of the LGBTQ plus community since stigma and discrimination still exist. There are a number of models of sexual orientation that have been proposed. Some are more nuanced than others, as you'll see. In early ideas about sexual orientation, they really depicted sexuality as dichotomous. That is, you are either heterosexual or homosexual. Really liberal thinking at this time might include bisexual, although this was sort of just thought of as either a confused homosexual or heterosexual wannabe. So this is depicted in Model A. It wasn't really until the work of Alfred Kinsey and his colleagues that we talked about in Chapter 2, where we started to understand that sexual orientation is on a continuum. Kinsey placed this continuum from 0 being exclusively heterosexual and 6 being exclusively homosexual, as shown in Model B. Since then, others have modified this more fluid idea of sexuality. For example, in Model C, people can be on a continuum of homoeroticism and separately on a continuum of heteroeroticism. So someone who is bisexual is high on both homo and heteroeroticism dimensions and will fall somewhere in the orange upper right-hand quadrant. In contrast, someone who is high on heteroeroticism and low on homoeroticism is more likely to be heterosexual, and fall somewhere in the blue quadrant. And you guessed it, someone who is gay, lesbian, bisexual, or questioning is more likely to be high on homoeroticism and low on heteroeroticism. A person low on both dimensions might fall somewhere in the yellow asexual quadrant. When we think of sexual orientation, we tend to think of it as unidimensional or on one dimension. That is, who do you feel a strong sexual interest in? But sexual orientation is actually multidimensional. And it's really these combinations and degrees to which individuals experience a few components or dimensions that help to define sexual orientation. So this was a model first described by Charles Mosier, and it has four different dimensions of sexual orientation. The first dimension is sexual identity, or how someone defines themselves sexually. As we talked about, identities can vary widely from straight to lesbian to queer. This can be a very personal choice. The second dimension is someone's sexual interest or attraction. That is, what individuals want to do sexually and who they want to do it with, whether or not they actually do it or not. So again, this is their interest or attraction, not necessarily their behavior. So there might be a lot of reasons that these attractions may not result in actual behavior. So of course, the third dimension is sexual behavior. So this is what individuals actually do. It isn't uncommon that someone could identify as straight and occasionally has sex with someone of the same sex or gender. Finally, Mosier also includes the dimension of sexual orientation, which he defines as a distinct type of an intense sexual interest. Now, honestly, I'm not sure how including this as a fourth dimension is distinct from the other three dimensions, since it probably encompasses the other three dimensions that I talked about before, including identity, attraction, and behavior. In any case, often in the research that I do with sexual minority persons, we'll ask participants what their sexual identity, their sexual attraction, and their sexual behaviors are to get a full picture of their sexual orientation. So just a quick note on what the prevalence of sexual minorities are in the US. The exact numbers of persons who identify as heterosexual, gay, lesbian, bisexual, queer, or transgender are not completely known, since many individuals may be reluctant to reveal their sexual identities. This could be due to stigma or just that persons who are asked are still in the process of understanding their sexuality. And as we talked about before, sexuality changes over time, so tracking the exact numbers can be really difficult. But according to a 2023 Gallup poll, 7.6% of American adults now identify as LGBTQ+. Among those people, so among that 7.6%, about 15% identified as lesbian, 80% gay, 57% as bisexual, 12% as transgender, and other identities in much smaller percentages included pansexual, asexual, and queer. Okay, identifying as LGBTQ plus often takes time, and different people have different paths to go about it. So, what is the process that leads up to an LGBTQ plus identity? The most intense phase is during late adolescence and early adulthood, where adolescents and young adults grapple with issues of who to partner with and their own sexual feelings. For some, the awareness of feeling something other than heterosexual occurs in phases. The first is an initiation of self-discovery and exploration, where someone might begin to question their attraction and also begin to explore sex with others who are not of the opposite sex. But it's only when sort of we integrate our sexual orientation into our overall self-identity that there is this sort of identity integration. Research that shows that persons who do not integrate their sexual orientation into their overall identity may have higher levels of distress. And notably, Healthy People 2020, which is a roadmap for health priorities in the US, includes a goal of improving the health, safety, and well-being of sexual minorities. All right, so as part of this process, many people choose to come out and publicly acknowledge their same-sex attraction. This process often occurs in stages with friends and family. Because of this, sexual minorities are often out, quote unquote, in varying degrees. For example, someone may be out to friends and family, but not out in the workplace. Often in the coming out process, people may feel the need to state their identity, such as lesbian, gay, bisexual, or some other identity. One term that's less common, but sort of people associate with being bisexual, but it's different, is plurisexuality. And this refers to romantic and sexual attractions, relationships, behaviors, and fantasies that are not oriented solely to one gender. So this is not, however, the same as bisexuality, since people who identify as plurisexual don't connect with this identity of bisexuality, but they may see themselves outside the sexual binary. Because of the historical and current negative attitudes in society about LGBTQ plus persons, some people who are a part of these communities may internalize these messages. This sort of negative attitude about homosexuality in oneself is sometimes called internalized homonegativity and can often happen when someone grows up in a social and family environment that denigrates and demonizes non-heterosexual identities. So there's been a lot of research that internalized homonegativity is associated with poor psychological adjustment and more risky sexual and substance use behaviors. Okay, let's change gears a little bit. So, what do we know about being single in college? We know that college is an important time for social development that includes exploring and finding potential partners. Dating may be formal or informal. So, in other words, informal could be include things like getting together or hooking up. And while there is a greater acceptance of sex outside marriage, women still are scrutinized more than men for being sexually active during this time. But being in college can often be liberating for sexual minorities, as campuses tend to be more tolerant of different perspectives related to sexuality. And this is a space where people may sort of meet the first person who has an LGBTQ plus identity. But what about being single and not in college? People involved in the singles world tend to be older than college students, typically 25 to 40 years of age. There are many reasons that somebody might remain single. This might be because they are prioritizing job seeking and employment over marriage. That said, staying sexually active still is a priority. This in part has launched sort of things like dating apps and hookup apps that cater to people looking to meet others. Being single outside of college can also, however, feel isolating. College is an easy place to meet other people and socialize, and those same opportunities simply may not exist outside of college. The most frequent means of meeting others tend to be from introductions by friends, dating apps, the internet, parties, and social groups. While certainly many people are single, singlehood itself is seen as, in general, as less desirable than being in a romantic relationship. So negative stereotypes and discrimination against single people is sometimes known as singleism. Some studies show that single people have poorer mental and physical health than coupled people, while other studies show a high level of satisfaction with being single. So there's a lot of variation in how single people feel about it, and that really can change from person to person. The staggering increase in the number of unmarried young adults in the US has several outcomes. These include the increase in the number of people who are sexually experienced and who have had more sex partners before marriage, also a greater acceptance of cohabitation before marriage, higher unemployment, higher numbers of separations and divorces, and more same-sex couples. And being LGBTQ plus and single has its own challenges. Today, there are large LGBTQ plus communities in large cities where sexual and gender minority persons can find acceptance and support. However, such minorities in the US have higher levels of psychiatric distress than their heterosexual counterparts. Now, importantly, this is usually due to the stress of being part of a discriminated group that imparts a great deal of stress and anxiety on individuals every day. The accumulation of stress and anxiety then can lead to poor mental health and increased substance use within these communities. So, in response to some of these factors, some people believe that relationships should not be hierarchical and that all relationship types have equal weight. And this is sometimes called relationship anarchy. All right, so what about cohabitation? So, cohabitation refers to the practice of living together and having a sexual relationship without being married. So it's probably not too surprising that cohabitation is more widespread and accepted in recent years given changing attitudes about sex and relationships before marriage. For many, it's a practical decision. For others, convenience. But it's also a significant legal, financial, and emotional step for those who choose to cohabitate. For unmarried persons that live together, usually called domestic partners, there are laws that grant some of the same protections of marriage. So before same-sex marriage was legalized, domestic partnerships were extended to same-sex partners in some states. And what was once thought of as a permanent arrangement, marriage has more recently given way to serial monogamy, a succession of relationships or marriages. Some people celebrate this while other people decry this. All right, so here you see the percentage of US adults who say that each reason shown here is a very important consideration to marry. Well, people who are married are similar to people who are not married, but living with a partner. They're similar in many ways. There are some interesting differences. For example, 90% of married adults say that marrying for love is very important, compared to 73% of people living with a partner, but they are not married. And for people who are living with a partner but not married, convenience and financial stability are reported by 37 to 38% of those persons as important reasons, compared to only 10 to 13% of married adults. So some pretty interesting differences. And as you know, same-sex marriage has been legal in the United States for many years. However, many people in the LGBTQ plus community might resist traditional heterosexual domestic roles. Rather, tasks may be divided pragmatically or decided on by who likes to do what. So if one partner enjoys cooking, then that partner might get the task of doing that in the relationship. And an important difference also might be that often in LGBTQ plus relationships, um, both people in that couple might work. So one partner does not necessarily rely on the other economically. For example, in a gay male couples, the earnings discrepancy between the partners may not be as wide as in heterosexual married couples. Rather, if there are discrepancies in tasks or economic earnings, these may be driven largely by someone's personal preference or by age differences. Notably, the US Supreme Court in 2020 ruled that federal protections extend to a person's sexual orientation or expression to protect them from job discrimination. All right, so we talked about sexuality in childhood, adolescence, and young adulthood now. So let's turn to sexuality in middle and later adulthood. In middle adulthood years, some of the psychosexual development tasks of young adulthood may still continue, but there are other developmental issues that also emerge. These include redefining what sex is. So when you're younger, sex might be an expression of an interest or of an intense desire to engage in that activity. As people age and take on both job and family responsibilities, as well as placing a decreased priority on sex, engaging in sex may be more of an expression of intimacy and caring. As with everything, how we think and act with respect to sexuality and sex changes. This may also be a time where we reevaluate our sexuality as we face things like how much should we prioritize being in different types of relationships, and how much should we prioritize other non-sexual acts of intimacy. And of course, the clock is ticking. How we accept or not accept the aging process becomes important. This is, of course, partly personal and partly due to how society accepts or doesn't accept people who are aging. Sex changes in marriage and long-term relationships over time. Overall, sexual frequency is declining among American adults. So one study showed that in 2009, adults in the US were having sex on an average of 63 times a year. That average fell to 47 times a year by 2018. Among other factors, age has a strong effect on sexual frequency, as do hormonal changes, children, stress, financial worries, fatigue, and lack of private time. And certainly, during the COVID-19 pandemic, sexual activity decreased due to isolation mandates. So it appears that married couples have sex more often than single people. And studies show that people in marriages report higher levels of satisfaction and pleasure than those who are single or in extramarital relationships. In one study from 2019, the happiest couples were those that reported being very satisfied with their sex life, having a connection in and out of the bedroom, and being open-minded about new sexual experiences. Divorce has also become a fact of life for many Americans. That said, the divorce rate has actually dropped. So from 1990 to 2022, the divorce rate dropped from 7.2 divorces per 1,000 marriages to only 2.4 divorces per 1,000 marriages. That's a pretty steep drop. The exception, interestingly, is for people 50 years of age or older, where the divorce rate has actually increased. Now, this may be due to a longer lifespan and the stress that comes along with the challenges and transitions that older people face, and that could put a lot of strain on marriages. So, what accounts for declining divorce rates? Like most things, it has multiple causes. That includes more cohabitation arrangements, people getting married later in life, and increased use of birth control that reduces the number of marriages that sort of come out of unintended pregnancies. And divorce will obviously have an impact on children. Slightly over half of all divorces involve children. Now, staying together when there's conflict may not be for the best. Children in high argument environments are better off with single parents than remaining in that environment. But the good news is that studies show that children whose parents divorce don't show long-term negative consequences because of the divorce. In fact, the outcomes of divorce on families depend on the quality of the parent-child relationship prior to divorce, and most of these children grow up to be well-adjusted adults who sustain family connections and commitments. Divorce, along with more births to unmarried women and delayed marriage, has contributed to a shift from two-parent households to one-parent families. Single parents are not often part of the singles world, like we discussed earlier, since they don't typically have a lot of leisure time and may be strapped for extra money that they would need in order to go out and be in the dating world. Then there is the issue of putting yourself back into the dating pool. Dating after a marriage evokes some of the same emotions felt by inexperienced adolescents. This may elicit some feelings of excitement and nervousness, but it certainly can lead to a lot of awkwardness. But sex is still important. Engaging in sexual behavior for the first time following a separation may help some people accept their newly acquired single status. It sounds a little bit like rebound sex. Okay, so the last stop on the sexuality through the lifespan train is sexuality in late adulthood. Sexual feelings and desires continue throughout life, and this includes among older adults. Now, there are a lot of taboos and stereotypes associated with sex and aging, so we're going to try to set the record straight here. Many of the psychosexual tasks for older Americans are directly related to the aging process. So these can include biological changes, where events like hormonal changes, illness, and frailty may require adjustment in sexual activities and in our own philosophy towards sex. So sadly, the death of a partner is common, and since having a partner is the biggest determinant of having sex at older ages, the death of a partner can be a major challenge. And of course, there are psychological influences, such as taboos against older adults having sex and individual mental health issues like depression that are common in older age and can be a barrier to sex. So think of the stereotypes that you hold or your friends hold of older people and sex. What might those be? Well, society stereotypes aging as a lonely and depressing time. However, in contrast, most studies of older adults find that they express high levels of satisfaction and well-being. In fact, until their mid 70s, most older people report few restrictions on their activities because of their health. The sexuality of older Americans tends to be invisible in part due to the negative stereotypes that society has about sexuality at older ages, which many older adults then tend to internalize. Society's narrow definition of sex that focuses on intercourse can unfortunately lead to older adults' disinterest in sexual activity. It goes without saying that sex remains important for many older adults. For these reasons, as the number of older Americans increases, their sexual interests and health needs really need to be addressed. Remember, this will be all of us one day. We know that the sexual health of older adults is associated with greater quality of life, positive relationships, and physical and mental well-being. These social and sexual connections can serve as important buffers to normal age-related declines. Now, among both heterosexual and LGBTQ plus couples, The happiest are those that have a strong commitment to each other. However, importantly, regardless of whether you're coupled or single, being flexible and adaptive about what we consider to be sex and what sexual experiences can bring us in terms of our satisfaction, these tend to be really key to having a healthy sexual relationship with yourself as you age. All right, so let's talk a little bit about women's issues. So females face a number of issues relevant to their sexual health as they age. So perhaps best known as menopause. Menopause is a point in time 12 months after the last period. The average age of menopause is 51 years. So most women experience physiological or psychological symptoms, including changes in their menstrual period, sleep, mood, and in their body. They can have hot flashes and difficulties with vaginal health and bladder control. And there's also sometimes an increase in interest in sex, and sometimes a decrease in their interest in sex. So that's really individual. For 13 to 15% of women, the effects are severe enough to use menopausal hormone therapy, or MHT. This is typically the use of estrogen or a combination of estrogen with progesterone or progestin in a synthetic form. However, the use of MHT may increase the risk of certain conditions and diseases, including breast cancer. For these reasons, it's recommended that patients take as low of a dose of MHT as possible. And among men, there are also a number of issues as they age. There are a number of changes in male sexual responsiveness as men reach into their 40s and 50s, which is sometimes referred to as andropause. This may be accompanied by a variety of symptoms such as hair loss, weight gain, decreased strength, depression, and a longer refractory period before ejaculation can occur. However, sexual interest and enjoyment generally do not decrease among men. About half of men over the age of 50 are affected by benign prostatic hyperplasia, or BPH, and this is an enlargement of the prostate gland. Now, by age 70, almost all persons with a prostate will have an enlarged prostate gland, which may cause issues with urination and the frequency of urination. Finally, in older years, many changes that we see during this time are erroneously blamed on decreasing testosterone levels. And testosterone replacement therapy has its own risk, including a higher risk of heart attacks and strokes. So older men should consult with a medical provider to determine the risks and benefits of testosterone replacement. And that's the end of this lecture.